In a world carved from stone and steeped in superstition, the reflection staring back at you was often the one you were stuck with for life. A world of brutal warfare, harsh justice, and unforgiving disease. But what if it wasn't? What if, through unimaginable pain and incredible skill, you could change your fate? We think of plastic surgery as a modern marvel, a product of sterile operating rooms and sophisticated anesthesia. But the desire to reshape the human form is as old as civilization itself. Long before us, ancient surgeons with tools of bronze and obsidian dared to remodel flesh and bone. This is a story of ancient plastic surgery, a story written not in ink, but in blood, scars, and a desperate pursuit of an ideal. And be warned, the procedures were anything but gentle. Our journey begins not in Rome or Greece, but in the Indus Valley, around the 6th century BC. Here lived a man who would be called the father of surgery. His name was Sushruta, and in his famous text, the Sushruta Samhita, he described over 1,100 diseases, hundreds of medicinal plants, and dozens of complex surgical procedures. But among them all, one stands out as truly revolutionary: the reconstruction of the nose. In ancient India, amputation of the nose was a common punishment for crimes like adultery. This created a desperate class of outcasts, forever marked by their shame. Sushruta offered them a radical, new hope. His method, now known as the Indian flap, is astonishingly still the basis for some modern rhinoplasty techniques. The portion of the nose to be covered should be first measured with a leaf. Then a piece of skin of the required size should be dissected from the cheek and turned back to cover the nose. First, the surgeon would carefully measure the missing area with a leaf. Then, he would outline a flap of skin on the patient's forehead or cheek. And now comes the hardest part. Remember, there was no true anesthesia. The patient was given a strong dose of wine to numb the senses, but they would be awake for what came next. The surgeon would make 2 incisions, lifting the flap of skin, but leaving it attached by a small bridge of flesh to maintain blood flow. He would then twist this flap of living flesh down, place it over the nasal cavity, and meticulously stitch it into place with threads of linen or silk. 2 polished wooden tubes would be inserted into the nostrils to shape them and allow the patient to breathe. The entire wound would then be bandaged with herbs and cotton. The risk of infection was astronomical, the pain unimaginable. Yet, for those who survived, the result was nothing short of a miracle. They had a new face. If surgery in India was born from punishment and reconstruction in Rome, it was driven by something else: vanity and the pressures of public life. For a Roman man, appearance was everything. Scars from battle were honorable, but other imperfections could hinder a political career. Medical writers like Aulus Cornelius Celsus, in his work De Medicina, dedicated entire chapters to procedures we would now call cosmetic. Roman surgeons were highly specialized. There were oculists, eye surgeons, dentists, and even specialists in removing growths and relaxing eyelids. One common procedure was blepharoplasty, or eyelid surgery, to correct drooping eyelids that could impair vision or simply look unsightly. Celsus describes making a small incision in the fold of the eyelid to remove a section of skin before stitching it shut. Simple, effective, and excruciatingly painful. Romans were also obsessed with smooth, youthful skin. Surgeons developed techniques for scar revision, which essentially meant cutting out an old, ugly scar and restitching the wound more neatly in the hopes it would heal better. But perhaps the most surprising area of Roman cosmetic surgery was treating gynecomastia, the development of male breasts. For a culture that prized masculine, martial physique, this was a source of great shame. Celsus describes a crescent-shaped incision made under the chest to remove the fatty tissue. These Roman surgeons were masters of their craft, but they were fighting a losing battle against the two great enemies of ancient medicine, pain and infection. Without understanding germ theory, even the most successful operation could end in a deadly fever. Days later, not all ancient cosmetic procedures were so sophisticated. Across the ancient world, we find evidence of far more brutal and strange attempts to alter the body. In ancient Egypt, evidence from mummies suggests attempts at post-mortem cosmetic surgery. Noses were stuffed with beads and bones, and abdomens packed with sawdust, all to give the corpse a more lifelike appearance for its journey to the afterlife. But what about the living? Baldness was a major concern for Roman men. Julius Caesar's famous laurel wreath wasn't just a symbol of victory, it was also a very convenient way to hide his receding hairline. Desperate cures included rubbing ointments made of bear grease and crushed mice onto the scalp. Some surgeons even attempted a crude form of hair transplantation, making small cuts in the scalp and trying to insert plugs of hair. The results were likely disastrous. Body modification wasn't limited to fixing flaws. Sometimes it was about creating them. Many cultures practiced ritual scarification, carving intricate patterns into the skin as a mark of identity, status, or spiritual passage. Perhaps most extreme was artificial cranial deformation, practiced by cultures from the Huns to the Mayans. An infant's head would be bound tightly with boards and cloth, forcing the soft skull to grow into an elongated, conical shape. To us, it seemed shocking, but for them, it was a profound symbol of nobility and belonging. It proves that the definition of beauty or perfection is not universal. It is shaped by culture, belief, and time. The ancient world of surgery was a landscape of genius and butchery, of incredible innovation born from desperate need. These early pioneers walked a razor's edge between healing and harming. They lacked our knowledge of germs, our gift of anesthesia, our advanced tools. Yet they were driven by the exact same impulse that drives us today, the desire to control our own bodies, to fix what is broken, and to present our best self to the world. The tools have changed, the pain has diminished, but the fundamental human quest for perfection remains etched into our history. When you look in the mirror, what would you be willing to endure to change what you see? The answer connects you directly to these people from a distant, brutal past. Let us know your thoughts in the comments below.